Okay, let's start this week's class. I think the last week we already give you some idea we are going on for this semester. Today I want to go to some more detail about this class about medical teaching support. So again, here's the syllabus. I will put the course slide and the video archive on this website. And if you want to join online, you can connect to the video conference through this link. Then the goal of the whole this semester class, we will show you the history of the clinical teaching support and the concept and the origin and the important thing, the case studies. We will go through several hospital talking about their experience and the different clinical teaching support application. Then we will show you how to generate the formulation knowledge and how to representing the knowledge, how to do the standardization and the knowledge management. And we will use the textbook as this one. I will send you the Dropbox link to my web to let you to download the PDF version of this class. And this is the in the rubber green. This book is written on 2002 or 2003, so it's kind of quite mature for year that several major hospitals they already have the important progress. So this is kind of a new era of the clinical teaching support. So you can look at some classic application of clinical teaching support. So this is the Robert Green, who is from the Harvard Medical School and Brigham Women Hospital. Here's the table content of this textbook. The first, we will talk about the clinical teaching support, the history, and some background. And we will talk about the feature of computer-based clinical decision. Then we will go through the case study and the current status. The first one, we will talk about the Reagan Street. Reagan Street is quite famous. Dr. Clint McDonald, he is the pioneer, or you can call it, is the father of the IT in the Reagan Street, and he currently is the NIH director. And as you know, that just a couple months ago, the NIH they created a data standard officer. Then the Dr. Clint McDonald is the first one, to lead the position. Then and also you will also know that Dr. Clint McDonald, he is actual the LOINC standard, the vocabulary creator. So it's yeah. And after the Reagan Strip, then we will talk about the partner, the experience from partner and the pregnant woman. This is also another place that is famous for clinical teaching support. And also the experience from LDS Hospital, which is where I learned, I think the LDS Hospital has the close relationship with the University of Utah. So we will emphasize the use case in LDS Hospital. Then after that, we will talk about, I will show you some different thing. We will talk about some statistic method, and we will design a hands-on course. I will give you a head injury database. Then we will ask you to install the Weka. Then we will design a class that allow you to go through some clinical decision work. So then we will also make some introduction about the different model formula which can be used in clinical decision support. Okay, that's the organize of this class, because I think the most important thing is I want to teach you the abstract thinking about the clinical decision support in practical setting, because probably some of you are IT background, some of you are physician background, but you should know some traditional use cases of the clinical decision support system, then you can avoid reinvent the wheel. Then you can know the history, then you can create some or your own new thing. Okay, I think previously we showed this slide before, but I want to go through this again. Let's talk about the history uh, about the relationship between the computer and the clinical decision support. And this computer use in clinical decision support is quite new. I think it's back to 1960 to 1985. At that time, computer is quite expensive, and probably you need to use some analog paper. You can do the pinch on the paper then to input the data. At that time, only some place they are likely to have computer, then they have the experience to use computer in clinical setting. Like in University of Utah, the pioneer, the founder of the medical informatics program, the professor Homer Warner at that time. Actually, he is a cardiologist, but he has a good friend who work in computer science department in Utah. And back then, you should know that University of Utah, they are famous for computer science. There are some big computer company like the Adobe, the Photoshop you use, and the NVIDIA. They their creator, they both uh, graduated or they are strongly related to University of Utah. So at that time, computer is kind of fancy, cutting edge technique um, in the surrounded in the campus. So the professor Homer Warner, he think probably we can use computer to make diagnosis for congenital heart disease. So that's the beginning that there are some enthusiasts who is familiar with computer. They also have who must be a physician. They try to combine the use of the computer in the clinical setting. But the problem at that time is the medicine is kind of conservative. They they only trust human and the expert result. So if you talking to the clinical guy that you want to use computer for making diagnosis, they just think it's like a extraordinary, some weird thing. It's just like the ET that time. At that time, probably the AI is equal to the ET is kind of a weird term for the clinical. So there's a long adoption period that some enthusiasm try to use computer in clinical setting. But after, I think after 1990, the PC price cut and the young generation, they grow up with the computer. So more and more physicians, they get familiar with the computer. So since 1990, I think there are some mass successful implementation in each institution. So I think it's quite similar in Taiwan or in TMU. I remember in TMU is around 1995 to 1998 that they start to adopt the computer in the computer. And I think that is the most popular time during that period. So you can see from 1998 to 2003, a lot of hospital they put a lot of resource on IT development, on adopting computer in the clinical setting. So back then they based on the computer, they are talking about some national scale agenda, call to action, then building the electronic health record and the computer-based provider order entry, the CBOE, or the electronic prescribing system. Sometimes we call it HIS, health information system. Like so, that's kind of I think since 2000 or 2005 that most things are well done. Though there are some continuous improvement, but that is more kind of a little bit slowly down on the development. But here I want to add a new cornerstone on since 2016. I think back to 2016, the AlphaGo, they beat the champion, human champion on Go game. Then at that time, then people just gain another new attention on using AI in computer. But here, if you know the machine learning and the statistic or the big data enough, you probably will know that AI actually is not a new thing. It just um, similar the the term to the clinical decision support system. Just um, but why right now the AI becomes so important? I think for clinical setting, the most important thing is not the AI beat human. I think the most important thing is currently everything, most of thing in the healthcare, in the hospital, they has been electronicalized or digitalized. Everything you want to compute put into the clinical decision support, or you say the AI is already in the digital format. So people can easily develop the software or any kind of AI related program to develop some clinical program. So I think that that's the more important thing is currently we have so many data could be used in AI. So here is some key component of the clinical support we will discuss in the future. We will talk about some decision model and knowledge base and the information model, result specification, and the application environment. So here, first I want to show the interacting life cycle underlying the clinical decision support. You can see that usually we start from the knowledge management and the dissemination. That means every patient's data we should put in the EHR first. So we have the knowledge management, we have the knowledge database, then we can implement the clinical decision support system. And usually people stop here. We only care about, we will develop a clinical decision support system. But for the quality issue, especially the patient safety, the evaluation process is quite important. That means everyone, when you create a clinical decision support system, after the implementation, then you need to benchmark your application performance. Then you will back to the knowledge generation and validation and go back to the knowledge process. And for example, there are some information are missing, you want to improve the performance of the clinical decision support system, then you will collect more data from the knowledge. For example, in my ICU project, we want to predict the patient's seizure status that in the traditionally we don't collect the EEG data, then we can right now we can put a biosensor on patient's uh, body, then we can collect the EEG from the patient. Then we can have the EEG data, we can go to predict their brain function. Then we can also, again, evaluate our EEG analyzer program. Then use that data to refine our clinical decision support system. So though this look kind of very simple, abstract, and fundamental thing, but this lay out a very important framework that all the system, all the clinical decision support system should go through this kind of life cycle, then we can believe that is a sound and a robust system. So uh, I think this is a very important fundamental. So I love this table, and I put it a lot everywhere it is, because we can utilize IT technology uh, for the different methodology for clinical decision support. And based on the complexity or the algorithm behind, there are some simple one to complicated one. I think from the first column, the information retrieval and the evaluation, logic condition, heuristic modeling, calculation, association. For the information retrieval, you can think it just like, I think the most classic information retrieval example, I think, is the Google. I think the major use is quite easy, is finding the information and answering question. So I think the most current hit system, like for example, the laboratory or the PAC system to use the radiology image, is all based on this kind of information retrieval application. So you just need to enter in some information, and the system will find the related information for you. So that is a very classic information retrieval issue. And there are some inside technology like the taxonomy, ontologies, test-based method, and patient-specific context key autonomous invocation. I think in the future, in the each institute, we will give you more example. Then evaluation of logical condition. I think it's very easy. We can use a very use a more simple way to explain this. You can call this kind of some rule-based system. Okay, rule-based system, that means if they when you displaying the data, then the data is has matched some rule, then they can activate another trigger another action, you can call it. So I think the alert, reminder, constraint, inferencing system is all belong to this. I think those alert, reminder, constraint, inferencing system is the major application uh, in the decision support uh, setting right now. Okay, then more complicated than the rule-based one, it go to the probabilistic data-driven classification model. Then Basically, if in the machine learning uh, term, we use the classification, then it will involve with the Bayes theory, distribution theory, ROC curve, and the data mining, logistic regression, and artificial neural network. I think this is the hard uh, or the important computation part of this class. So we will design a hands-on course. We will help let you to uh, download the health uh, data. Then we will teach you how to use the data mining software to perform this classification, or you can call this supervised or unsupervised learning technique to have let you have some sense about using the uh, data mining program to perform the clinical decision support task. So that's this part is very important. We will have a class talking about this, and we will also design a hands-on course doing this. Then there's more the uh, heuristic modeling and expert system. Basically, they will make some diagnostic and therapeutic reasoning and capture the nuance of the human expertise. So they will use this to create a rule-based system, frame-based reasoning system. This is some called the knowledge system. Then we will have some calculation algorithm and multiple step progress. So in the hospital, you can see we can extricate of some computational process, the flowchart-based guideline and the consultation, and interactive dialogue control, and biomedical image and the signal processing. So this will go through the process flow and the workflow modeling, guideline formalism, and the modeling language. Okay, so then sometime we can also create some associative grouping of element. Then it will help you to structure data entry, structure report, order set, other specialized presentation data views. Then it will involve the report generator and the document construction tool and document architecture, template, markup language, and ontology tool and ontology language. Okay, this is a kind of summary about the clinical uh, design support used in the clinical setting. Okay, here I'll give you some uh, image screenshot about the information retrieval system. I think all of you if you work in hospital, this kind of laboratory information system is kind of quite familiar. Right now, you can see this is the electrolyte, and this is the data, and this is the reference value, and this is the point of day collect the data. Then here you can see here there is an I. I is the mean info button. So you can see that you can click this I, then it will show you some further information here. They can display some related information, for example, the meaning and the reference value and so on. So you can see that this is a quite simple screen layout. The laboratory information system, the value, and here the info button. So you cannot imagine that actually one of my senior when I doing the PhD in University of Utah, there is a person, a student who just working on this simple info button. But I won't call it simple, but you can see it's quite straightforward. They just develop a standard of the info button. Then he complete his PhD degree. So you can see that if you are creating something uh, they has no people done before, then you can publish on paper. So this is a quite uh, simple demonstration on the information retrieval application. So you can see, but right now this is the example from 2000. So it looks kind of quite easy, but you can back then that before that everything is on the paper. You can see that the breakthrough that those laboratory report in electronic form, then they can have lots of visualization like this, use the different color to highlight the critical value. So this is a very classic demonstration on information retrieval in the um, health system. So this related to probabilistic. So you can see uh, in the clinical setting, people, especially the physician, they are struggling on this. This you can see this the arthritis, carditis, and chorea. So you can see that all of these share the similar symptom. So this is the daily work about for the physician. They try to collect the symptom from the patient, then they try to decide the patient is more close to each diagram um, based on the symptom. So this called the probabilistic model. So this is another example. When we talk about the spectrum of clinical cancer, uh, we can categorize them to primary, systematic, metastatic, and in symptomatic tumor. So that's the Venn diagram for the clinical spectrum of cancer. And this is the rheumatic fever here. You can see if patient they have the rheumatic fever, and they can be associated with to those uh, different disease. Okay. Okay. This called Bayesian theory. This is very important. This is the fundamental of the knowledge creation for the clinical doctor. Basically, the idea I usually I wa- I will use a story to illustrate this example. Imagine right now, this is the room in the doctor in the hospital. Then there is a patient stand outside the door. Then we don't know he has any kind of disease. So if you ask me to guess the disease of this patient, then I will have no idea. So if I need to guess, then I just simply guess through the prevalence of disease. And for example, this is if this is an ENT clinic or just a ordinary clinic, then I would just guess this guy probably come for fever or come for common cold, cough, this kind of sort of thing. But if you can imagine that uh, if this room is belong to the gynecologist, or for example, let me think about easy one. Yeah, I think gynecology is okay, good. Yeah. So if I told you more information that this is the gynecology department and the patient is a young lady and uh, her belly is a little bit elevated, then you probably you can guess that is coming for consulting some question regarding the pregnant or something. So that is the perfect example that with more information was given, then you can have better chance to guessing the condition. So that's the basic idea about the patient's theory. So I think every day the doctor, uh, when they making the differential diagnosis, is based on this. They collecting the symptom. I think here, especially the ER doctor, each time when the patient come in, they will ask their symptom. Do you have the headache? Do you have abdomen pain? Or do you have trauma history? Actually, they are doing the patient calculation on their mind. So, yeah, but here just to give you the rough idea. This formula is not that easy. I can tell you, for my master degree, I use the Bayesian theory to create the modeling of gene disease relationship. And it took me several years to figure out, to really understand the Bayesian theory. But here you just give you a rough idea about let you have some tests about what we are doing on clinical decision support. So later we will give you some more related info, the example about the Bayesian theory. And also you should know that the Dr. Jack Lee, his PhD thesis is based on the Bayesian theory. Okay, so let's move to the another one. This the decision tree. I think if you are a physician, you will feel very comfortable about seeing this because the decision tree is more familiar with the physician. Because usually we will have this kind of decision tree based on the treatment or the symptom, then for a patient, we can categorize them into a different subgroup. The decision tree is one of the most acceptable knowledge representation way for physician to illustrate the clinical question. So I think this very common decision tree method. In the future, we will teach you using the wake up program. We can use the wake up to make a decision tree automatically. Then we can also use this to draw the graph. Then after this class, then you can learn how to create this kind of decision tree from clinical question. Okay, this is the patient network again. This they show you that you can see this the BRCA1 gene, BRCA1, BRCA2 gene. Based on this, you can predict the probabilistic chance to get the breast cancer. So you can see that why we will have this direct cyclogram. So you can see that those nodes are related to breast cancer gene. So we know the BRCA1, BRCA2, they are two important sporadic gene mutation for breast cancer. Then I think the current age and the relative under 50 having the breast cancer is strongly related. So using this spatial network net, we can calculate precise, I won't say precisely, but approximately um, to estimate the chance you get a breast cancer. And I think here I want to emphasize one thing again is you can see that uh, why we need computer, because you can see all this information is already beyond humans uh, under ability to understanding. So we really need computer to help us to estimate, to management this complexity. So without the computer or those computation model, that the physician really hard, is really hard to calculate the risk for the based on the gene. Okay, I think this another example. I think this quite often we use to do the data entry in the his information. So you can see that when, for example, doing the writing the information, the admission note, or the CPO system that we will enter those information. So go through this kind of interactive dialogue. Okay, this continue the list of the purpose and the key methodology of the all the different subsystem of clinical decision support system. I won't go through this in the future. In the each institution, we will discuss this use case more detail. Okay, this is a conceptual model of clinical decision supports design component in the hospital. You can see this. This part is very important that we put the electronic health record, the patient data here. Then the user here, usually we use the web-based or the standalone system. We try to input and query patient's information data here. Then separately, we will create a clinical decision support module. Then, for example, the very quite common we use is the risk high risk data laboratory data alert system. Then usually this will create this. We can create a rule here that if when the patient, the physician order a laboratory to here, then after the laboratory result was correct, then if the data and some important electrolyte, for example, the kalemia, if there is a high kalemia, then they will trigger this clinical decision support system. Then they will send a text message to physician. So this is very important. This is we want to separate the clinical decision support module from the application environment, because we know the daily administrative work and the HIS system is quite important. You don't want to mix those clinical decision support logic in here. So we want to separate a system, then we will retrieve the data from the application environment into a clinical decision support module. Then we can run a batch to execute the engine, then to deliver the text message. So you can see that this is the data flow. And later we will discuss, here I won't say too much, is the how to trigger this is very important, but it depends on the emergency of the data. You can imagine that for the electrolyte, especially like kalemia, those things, or the cardiac enzyme, the critical value, is quite important. You want to uh, inform the doctor promptly after the critical result. But for those blood culture or the the some last emergency text message, then you won't want to alert or disturb the physician all the time. So um, here is how to invoke the process and pass this to execute engine. It need to be considered when you developing this kind of clinical decision support system. And here I want to give you another example on the early development. In the LDS hospital, in their ICU setting, there's a professor, I think Scott Evans. He is a very prestigious uh, people who are making the clinical decision support system. There's once he developed a alert system that whenever there's a accidentally extubation or disconnect of the ventilator, then we all know that that is a very emergency situation for the patient. So he implement a system that when the patient, their ventilator is disconnected, um, all the ICU computer will be hold, and they will show a display information, say, for example, the bed number 6, the patient uh, ventilator disconnected. So everyone will know. From intuitively, you will think, okay, this is brilliant. Then um, it's very obvious information that everybody will know the ventilator is disconnected. But if you put it to the real setting, that you will notice that actually every day this kind of disconnection is happen all the time. For example, when people they just want to clean their sputum, they will intentionally disconnect the ventilator. And also, actually, sometimes the disconnection, you just need to inform that uh, the nurse who carrying that specific bed is enough. So uh, they launch that a very you can see very prompt system that when the ventilator disconnect, then everybody will know. But the problem, the after they work for a while, then people just feel that is very too noisy because that just happen too often. So it's not good to stop to put that kind of system hold for the all the machine. So you can imagine that when we develop any kind of clinical decision support system and put it into the clinical setting, you need to be very careful about don't slow down the clinical workflow. That's a very important thing. So later we will give you more example when we have the use cases. So yeah, I think this is a very good conceptual model for you when we developing a clinical decision support system. So yeah, as I told you, this is a very far beginning. The mainframe used in the early day of in the Reagan strip. This is their mainframe. And yeah, personally, I go through this kind of date that we use the paper-based to report data. And this the drug allergy alert. I think uh, we already have this, but back to 20 years ago, this kind of fancy thing is it will remind you that you need to be careful about using a drug. So currently, the drug-related alert, they are too much. For example, the drug-drug interaction, then the creatinine, and we also know that for the administrative purpose, the NIH, the pharma cloud, we allowed uh, the patient, uh, we can view the drug history from previous hospital. I think this all are very useful for physician to retrieve the information when they're prescribing the drug. So, uh, and also they will tell you. I love this system. Is right now in most hospitals that when the patient having some allergy to certain drug, they will put a mark on the system. Then that will actively notice us that to avoid using this kind of drug. So I think that is very helpful. Then also some calculator, you can based on the kidney function, you can adjust the antibiotic dosage. Those things are very important. This is another great diagram architecture map to show you the help. Help. This is the HIS information system from LDS hospital. You can see that this is the main electronic health record system. Then they have many subsystems. They have the nurse, the transcript detection, the nurse care plan, infectious disease control, pharmacy, ECG lab, X-ray, blood, gas lab, surgery schedule, medical record, admission note, respiratory, RT therapy, physical therapy, blood bank, pathology, and go through the financial system and the IV pump, medical device, ventilator, pulse oximeter, bedside monitor. So we have tons of subsystems surrounded by the electronic health record. And you can see that the AIoT developing. So we, in the future, we can see this part, we will have more and more medical device created to provide the continuous monitoring that will have the great impact for clinical setting. So you can see how they work each other. So um, then this is the administrative data that all the information here. Then like the previous slide, we said that how to trigger the clinical decision support is very important. We can do a time matter or the data matter thing, uh, because you can think that usually the the emergency one, then we will go through the data driver. That means when the data is fulfilling some certain rule or constraint, then they will trigger those other suggestion and so on. And some will execute based on the time driver. For example, in the everyday morning, I will receive a text message. It will tell me that today how many patient will discharge and how many will be admission. So that kind of message, it's usually is not the quite urgent. So they just send to you based on a timely fashion. So that so you can think that in the hospital, when we trigger the clinical decision support system, we can have the data driver or time driver to trigger it. So, but I think mostly currently the IT IT guys and the physician, they all know well about this. So we carefully deliver those alert message to physician. Yeah, the important thing is we try to avoid the alert fatigue. That mean is if we send you alert all the time, no matter it's important or not important, then the result is the physician just ignore the alert. Okay, so you got the idea is um, we need to care about the efficient and the necessity about sending the message. Okay, this I think this kind of repeat thing is the patient data will go to the data driver and go to the electronic health record, then go to the decision support system, then send the alert file. Then this kind of diagram, when you want to create the machine, you need to avoid slow down the machine. But right now, this become less important is because currently computer is so massive and so powerful that uh, it's not really important that we really need to uh, fulfill this kind of constraint. Actually, uh, mostly we will follow the guideline of programming. Then that is mean uh, easy to maintenance. So, but just let you give you an example. When you want to create a clinical decision support system attached to the electronic health record, this is the diagram you might see. Okay, and I think this is another uh, example about how to retrieve the data information. Then I think the the best example of this is the Wan Xiaofang in the Wanfang Hospital. That is a chatbot automatically send back the message, the message through the expert system. Basically, I think this will kind of very useful is we always the patient want to talk to expert, so having this kind of information, we can try to communicate the expert through this kind of decision support system. Okay, this is another example about the knowledge presentation about thyroid disease. So you can see the left-hand side, this is the algorithm to predict the thyroid disease. You can see the TSS function and the T4 function. Based on these two, we can create the bivariate logistic regression model. See this, I think this is kind of popular to be used in traditional clinical journal, so we can use this. And another, compared to the left-hand side, the right-hand side, we can have a more complicated one. You can see the artificial neural network one here, and you can see actually this is a quite old thing. I think this developed uh, 15 years ago, 50 years ago. Then the Bayesian theory, they all based on this kind of artificial neural network. And right now, I think people are familiar with this, the CNN, the convolutional neural network is something look like this. It become the heart of AI thing. As I mentioned at the beginning, that the AI or the artificial neural network is not a new thing. Actually, it already been created quite long. So in this case, is TSH and T4, they all link to some hidden nodes. Then they will have some different interaction. Then sometimes we call this layer called black box, and they use this to predict the thyroid disease. So what's the main difference between the left-hand side and the right-hand side? I think the important thing is the left-hand side, the formula, they only calculate um, the probabilistic or the inference from each single parameter. We don't have the interaction between the TSH and T4 because we know sometimes we need to have the both enzyme or the endocrine together to see the effect. So for example, we want both TSH and T4 are low, then can create the thyroid disease. Then based on this formula, cannot really uh, observe simultaneously the effect of TSH and T4. But in this the neural network, we have some hidden layer. So the both both factor of TSH and T4, they all contribute to a hidden layer. So, and they have the different weighting. So we can create a more sophisticated model for the predicting the thyroid disease. So I think the CNN is have some revolutionary progress on how to create this there. So you can see we have a boost research based on the CNN or you kind of DNN. Basically, this is kind of quite old theory developed before. Then I think this one is the classification tree. This one is more embraced by clinical doctor because for clinical doctor, we really don't like the black box. Sometimes we challenge it is unexplainable, and uh, compared to the black box, this can be more acceptable for clinical doctor. So you can see this is the classification tree that based on the TSH and the T4 and TSH T4, we can draw this diagram and use this to create a visualization of how to diagnose the TSH abnormality. So this one is more intuitively for the physician to explain the problem. But again, back to this, recently on the image recognition or the reinforcement learning, those things, we all use this kind of AI strategy to find the optimized treatment way. And we can see that 20 years ago, the clinical journal, they are object to this kind of black box thing. But right now, they prefer this kind of decision tree. They are more explainable. So right now, the clinical practice or they are more accept this kind of artificial neural network thing. Okay, this is another more complicated decision tree one for the acute chest pain. I think especially for the ER doctor, they are doing this kind of classification tree all the time. They have all this triage for different disease. So this kind of familiar. So in the future, in the hands-on course, we will teach you how to use the software to create this kind of decision tree. Okay, that's all for today. That I give you some example about the clinical decision support system, the functionality in the hospital. Then we also demonstrate some different application about the clinical decision support. Give you some favor about what this looks like. So then the next following week, we will consecutively introduce the three different hospitals. We will give you the example from Regenstrief and the partner and the LDS hospital, talking about their clinical teaching support system. Then after the introduction, then we will continue our hands-on course. I will distribute it the health data, then I will ask you to install the wake up program. Then we will try to exercise on some artificial neural network and like something like this decision tree and so on. Okay, that's all for today. Thanks.